Right. Okay. So if it's your first or second, or if it's your 20th, you're all welcome here. And can dive into a really interesting topic tonight. Just get Mark in here.
Hey there.
There we go.
Okay.
There you are. Hello, hello.
From my outdoor office.
Yeah, great. Nice. Okay, so we'll get going. It's 6 o'clock, and I'm going to stop the share for now. And can everybody see both of us there? Should be able to. Okay, so this is our second last. We have one more Monday night webinar for this round. This season, I suppose, before summer. And then we're going to have a few. I do have talking to a couple of guests about joining us throughout the summer. So we'll have a few like pop-up webinars here and there. Please feel free to email me with any topics. I do follow up on them. And a lot of the topics that we have talked about have come directly from suggestions from you guys. So yeah, there'll be a couple over the summer, and I think Juliet and I will try to run one regular weekly class. So we have tonight where Mark and I are going to chat on perfectionism and pain. And then we've got next week, we have Dr. Eleanor Stein, who is coming to us from Calgary, to talk specifically about her specialty, which is fibromyalgia. She actually specializes fibromyalgia, chronic fatigue syndrome, as well as living with it. She also, she's a psychiatrist who's focused her practice on it. So if you've got fibromyalgia, please try to come to that one. Okay, before we dive in, I'll just check empowered relief. You know, Mark, we haven't scheduled anything for the summer, so definitely in September. However, if there is a lot of interest over the summer, maybe Mary Ellen and I will schedule one, one throughout the summer. And for everybody else that's here, if that is of interest to you, please let me know, because I'll keep track of that. Yeah, good question, Judy. She's going to focus, because we needed to pick a focus. So she's going to focus her talk on fibromyalgia. But it's very similar to how she treats chronic fatigue syndrome. So I'm going to say it's going to be mainly focused on fibromyalgia. So, but you're free to ask her questions about chronic fatigue as well. Okay, before we dive in, Mark, I'm going to turn it to you to get us going here.
Okay. Yeah, just welcome to everybody. I see we've got a pretty big group there tonight. So yeah, welcome on behalf of the
I'm hearing a lot of echo. Try again?
Can you hear that?
That sounds okay. Yeah.
Oh yeah. I think there's maybe a motorcycle going by in my outdoor office here. So yeah, just welcome on behalf of the Nelems Pain and Research Center. Yeah, to everybody. See, it's a pretty big group tonight. I think it's an interesting topic. And yeah, again, next week topic on fibromyalgia, I think will be pretty amazing. I think she's got a lot of expertise. That'll be our wrap up for the summer for most of the classes. I think, we'll probably take a break for July and then come back in September. So yeah, welcome on behalf of the Nelems Pain and Research Center. So yeah, I don't know how you want to do this, more like a sort of informal chat.
Yeah, versus... I mean, I do have some slides, but I think people are having trouble hearing you. And I'm hearing a lot of background noise. So I don't know if it's if there's something in your backyard or in your
there we go
headphones.
I'm not sure. Is that any better?
It sounds good to me. And yes, I think that's good. You guys
Okay.
can keep us, keep us posted.
There we go.
Great. Yeah, placement of the microphone probably.
Mm-hmm.
Yeah, so for those of you that might be new here or new even to the clinic or to the website, we did do a webinar on perfectionism and pain with Dr. Andrea Moore, and that was about a year ago. It is up on the website to watch under past webinars. So I don't want to repeat too much of what she says. It was actually a good one. I went back and watched it. We want to kind of review some of the things just to kind of get us all on the same page. And then we're going to move on to, actually what we can do day to day around having perfectionistic tendencies. So somebody's having trouble hearing anything. I'm not seeing that from anybody else. So Shane, maybe just look at your good now. Oh, something funny going on here. Okay. Let's keep going. So it turns out that even if you wouldn't describe yourself as a perfectionist, and you might automatically think of people in your life who have really high standards, or maybe keep a house that is spotless, or are, maybe demanding of themselves and other people. And we probably all have somebody in that life or in your life that's like that. And you may not necessarily define yourself as a perfectionist. But the more I talk to people and the more I work with people and I work with myself, the more I can see that we all have been born into this world, and for a variety of reasons, have what we could call perfectionist tendencies. Either as a result of being in the world, society, and what gets praised and what gets criticized. Also related back to maybe how we were brought up, what we learned as children. And in some ways it has really helped us. So we never, well, here's something. Here's something to check out. As you're approaching this webinar, just notice in yourself if you're really leaning forward, like you're trying to get everything, maybe you're taking notes, maybe already you're kind of worried about being able to understand this completely, or you might miss something. If that is the case, I'm going to encourage you to just sit back a little bit and be aware of going into more of a receiving mode. So it's almost like you're receiving the information, and to make it simple, to give your perfectionist a little bit of a rest tonight, if you take away one or two tips or sentences or something that somebody says in the chat that resonates with you, let's look at that like success. So right now your perfectionist might be going, well, no, that's not enough. So right now I'm going to ask you just, to talk to your perfectionist and just kind of say, it's okay. One or two things, if I make those shifts, that's going to be good enough for tonight, and just see how that goes. So we don't want to banish our perfectionism. We don't want to tell ourselves that being perfectionist is bad, because that creates stress. But as you look back in your life, you may see ways that being looking for perfection, striving for better, trying really hard, really efforting has helped you. And well, I'm going to stop there for a moment. And, Mark, is there anything that where you are now working as a pain physician, I'm guessing there must have been some times in your life where being really striving for the best worked in your favor?
Yeah, I mean, absolutely. I think, it's the nature of how we're trained. You're very much like marks or outcome or approval driven. I don't think you can get away from it. It's very difficult. But in terms of just bringing it back to how we function in our everyday lives and in terms of pain, to me, if you relate it to some things that we're going through, whether it be pain, anxiety, etc., it's almost a way of gaining control over something so that you feel like you might have control over a part of your life. Makes you sometimes feel better about the part that you don't have control over. So say, for example, you have chronic pain. Uh, you know, nobody I know with chronic pain has got complete control over it. It's very scary because your life is a bit of a roller coaster, or could be. It's difficult, and it's something that's out of your control a lot of the time. No matter how much you'd like to fix it, no matter what you sometimes do, it doesn't always have the outcome that you had hoped. So sometimes being perfectionistic or somewhat obsessive about certain things, in my observations, and I can reflect this on my own life. Sometimes when you get stressed, you take control over things that, or you obsess or be more focused on things that you can control, because it's a way of diverting your attention to something that you can control as opposed to something you can't control.
Right. Yeah. And so, you mentioned focusing on outcome or focusing on, how things are going to turn out, or which really is very difficult in the journey of chronic pain. Because when I think, probably most people here can resonate with, if we're focused on getting rid or no pain, which is, of course, so
Right.
natural to want that. Every
Mm.
person here wants that. That's why we're here. So it's almost like counterintuitive to be able to let go of that. And I think this
Mm.
is where the balance comes in between continuing on the journey, showing up here, and also going easier on yourself.
Yeah,
Um,
I think in chronic pain, there's so many aspects that people or patients want to get control of. There's the pain itself, and then it's, every time you see your healthcare provider, maybe there's something they've missed, or an investigation they haven't done, or something that hasn't been uncovered, that will help me. So there's that, looking for answers, looking for the perfect solution. I don't mean that everybody does that, but I think a lot of patients go through that journey until they make peace with the fact that you might not find the exact cause. It can be multifaceted. You have to let go of that. You might not have the
mhm.
perfect solution. Um, Most of the treatments are not going to take away all of your chronic pain. Um, you know, the investigations won't always show the exact cause of your chronic pain. If that MRI, maybe it missed something. Maybe, if you have this scan, it will show me.
Yeah.
It's generally not the case. And that's hard to come to terms with in itself as a journey, and it's not something you can tell someone, while you just come to terms with it, because that doesn't work either. It's a process where it's letting go, as you said. And I don't mean being lazy. I mean coming to realize that
Mhm.
probably as much that can be done has been done. And then you're left with how you manage your emotions, your pain, and everything that's wrapped up with it.
Yeah. 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 I mean, this is one of the things that we're going to look at, that, it may feel to the perfectionistic part that is not all of who you are. That's just a part. To that part, it may feel like giving up, or, letting go, or something like that. But in reality, when we start to come to maybe the not looking at that perfect outcome, it's counterintuitive, because then your
Mhm.
nervous system, which is what we're going to talk about, is in less fear. And as we know, fear causes causes more pain. So it's a really tricky thing. And I see, yeah, some people say, like Nicole, it's difficult. And then some people are writing, just if you want to share it with everybody, just to messages to us, and it's been a long journey. And also a really important point here that someone says, I won't do something unless I know can anybody else relate to this? I won't do something unless I know I'm going to do it to perfection. And so some projects never get done. And so I'm a procrastinator. And I think, just the fact that you are here and talking about this and listening, and you can see the pattern is you're bringing awareness to the pattern already. Mm-hmm. And yeah, and then it comes to like, okay, now what do I do? No, what do I do about that? Yeah, that's a tricky one, because it leaves us in a place of avoidance and not embarking or taking, maybe small risks unless we know we're going to do it perfectly. And that really leaves you in a, does anybody here feel then that their life starts to shrink because of that?
Mm-hmm. Yeah, that's interesting. And then you've got to ask yourself, so if you just did something, but you didn't do it perfectly, is it really that critical? Maybe you would enjoy the process of doing something rather than beating yourself up over not doing it and procrastinating. Rather do something and make an attempt. It's the best you can do. And, be happy with yourself for that.
Yeah.
And then the other thought I had about some of our thought processes in pain is some people are really afraid that if they're not sort of hypervigilant or striving for the exact, look at everything, maybe someone misses something that might have been discovered that might cure your pain. I'm just reflecting back on sort of encounters that I've had with patients over the years. And I get that, I understand that. I mean, we're not perfect either by any stretch of the imagination. But at the same time, you do the best you can with what you have. But generally speaking, if it's chronic pain, there usually isn't a magic cure solution. Just take this, it's going to make everything better. We're talking about people that have been struggling with this for months and years, where, if there was something, it would have been, discovered by now. And I don't mean to be negative. What I'm trying to say is it's a struggle in our nervous systems to come to terms, which is so much of what we teach about calming your nervous system, coming to terms with it, how you deal with what's happened or happening to you. Yeah. Because it's a struggle. It's a huge struggle,
Absolutely. Mm-hmm. And I'm just reading things, and I really so much compassion for all, the comments around avoiding pain because it hurts. Everything that's written here is so human, right? It's so human to want to avoid pain. It's what we're designed to do. Being scared, hearing the words, I can't really help you. It makes it difficult, because I think the message you hear is there's nothing that's going to help you, which is actually not necessarily true. And perfectionism, says that things must get better. So I want you to just notice when that must, or that things should get better. I mean, it's a really normal thing to think that it has to get better. And at the same time, not losing hope, but also not creating that tension in the nervous system where we're so focused on the effort and the effort towards things getting better. I don't know if I'm saying that right. But hard not to be cranky, bitter, and grumpy, right? And anybody else, who wouldn't be if they had pain? Yeah. Pushing through the pain. It's okay to relax, take a break, and recenter myself. Yes. So there is another way through this, and a way that it's not giving up, it's not losing hope, but a way that feels more balanced, maybe not to your mind, to the perfectionist, because perfectionism lives in the mind, but feels better to your body, which is where we feel the pain. Mark, do you think this is a good time to just run through some slides?
Sure.
Okay. So let's just get do this for a few minutes, and then we'll come back to more discussion. So I want you to just sit back and realize that all of you is welcome here. So all parts of you. And we often feel like we need to show up a certain way, to be a certain way, or I should be this way. I should be trying harder. I should be better than I am. I just want to welcome even those parts here. You know, all the parts that even feel like things should be different. And when all those parts of us, if you can just kind of feel that welcome here, to begin with, to take what I call a safety break. So if there's one slide that you might want to remember, it might be this, and I'll tell you why in a minute. Just start breathing a little bit slower, especially if you know the conversation brings up emotions and past journeys, maybe some grief. Notice any muscle tension. Maybe release any muscle tension in your body. You might feel your feet on the floor or where you're sitting. And we're bypassing the mind here by just looking around your space, and that uses our sense of vision to give the message directly to our nervous system that right now you're safe. And the reason I say that is we're acting directly on our nervous system, because when we try to tell ourselves, don't worry, you're safe, you don't have to be perfect, you don't have to get this right through thoughts, we don't always buy it. And in fact, sometimes that can make us feel even more safe, because our body might be saying, well, I'm actually not feeling very safe. So perfectionism and chronic pain are linked. Not that, one causes the other, but there is a link between the efforting or the intense focus of a perfectionist and chronic pain. So we learn in being perfect or excelling are praised by society. We learn very quickly how to get approval from the outside world. And that probably started, way back right around the time you were learning to walk. And then absolutely reinforced through school, through being marked, through being compared to other people in your class. And we learn it as a way to be accepted, to be approved of, loved, and included. And all of us have learned this to some extent. And it also creates a state of feeling unsafe and overwhelmed, which feeds pain. So you haven't done anything wrong. You haven't caused your pain. It's not your fault. But at the same time, it's useful to take note of this. So pain, as we've said so many times, is a danger signal in the brain, and that sends this cascade of chemicals and reactions in the central nervous system that creates an internal alarm system. So it's like everything on alert, become more hypervigilant, which means like checking, becoming maybe anxious, becoming fearful. And but with chronic pain, where this signal has not turned off, it's still very real. And these false alarms are just as loud as real alarms. So it could still feel like you've got your hand on a hot stove. It could still feel like there's really like a broken ankle, like it can feel the same even when the body has healed. So I just wanted to bring that. Mark, do you want to say anything about that just before we move on to what causes more fear?
I think, you've summed it up pretty well there. Yeah, I
Okay.
mean,
Yeah.
it's if you think about it, the fear is such a primal, um, you know, motivator or sensation. Like fear drives most of what is behind what we're experiencing,
Mm-hmm.
It really
Mm-hmm.
does. It's one of the most primitive emotions that we we're probably the most primitive.
It's all about survival.
And it's what drives us to survive, It's
Yeah.
mainly fear driven. And that's deeply rooted in our survival as a species over
Yeah.
the eons. I mean, you know.
And that's why telling yourself, "Oh, I am safe. Don't worry. Relax."
Mhm.
Has anybody here ever been told to just calm down? Doesn't that make you just want to like just
Scream.
scream or just relax or don't be so whatever. Like
Mhm.
it's just not that easy. And this is why affirmations don't always work. Like, okay, I am safe, but yet I still feel so anxious. And that's, I'm going to show this little slide here, protectometer. You might remember this from one of the webinars. On one side, we have indications of danger in me. The other side is safety in me. And these are things you do, you say, maybe you hear, see, smell, taste, touch, people in your life, places you go, things you think about and believe. And these are all ways that right now you can create more danger or more feeling of safety in your body. And it turns out that the traits of perfectionism that we're going to talk about tend to cause more feelings of danger. I don't see how they couldn't. They've been helpful before, but maybe not quite now. So, what does perfectionism actually look like for you? Often it's being highly demanding and having very critical of yourself. Nothing feels quite right. It might come in the form of hiding your pain, like everything's fine. How are you? I'm fine. Everything's fine. Or like just, not feeling like you can be vulnerable, right? Behind perfectionism is often, shame of maybe just being yourself or shame of not being able to get it right. Because pain, let's face it, you can't get it right. Yeah, I don't know what right is when it comes to chronic pain, or trying to prove your pain to someone, feeling like you have to, maybe it's to your doctor or to your family, feeling like you have to prove it. Being very hard on yourself and other people, the all or nothing thinking, black and white thinking, lots of shoulds, feeling anxious, not good enough. We talked about, some people mentioned procrastination. If I can't get it right, I'm not going to do it at all. So it never gets done. Afraid of making a mistake. And if this isn't one of the biggest curses of being human, I don't know what is. Because there's nobody that makes it probably through a day without, and I'm going to put quotes around mistake, because even mistake is just kind of life happening. If many things that happen in our lives just happen, and some have good consequences, some have not so good consequences, but yet if we live in that fear, as we said earlier, our lives will shrink very much. So avoidance of trying new things, activities, and or seeing new people or people. So when we're talking about safety in your nervous system, it never happens in the future. It only ever happens right now. So yeah, if we're saying like, okay, well, tomorrow I'm not going to be perfect. I'm not going to try so hard. It's not a bad thing to say. I'm not going to worry about fixing. I'm not going to worry about, so already we're planning for tomorrow. So I'm going to encourage you to make it simpler for yourself. Don't let the perfectionist go in there and start making a plan about how you're not going to be a perfectionist, because this is kind of what happens, is that we start making a plan for how I'm no longer going to do that and I'm only going to do that. It
Mhm.
can only happen right now. And what I mean by right now is allowing yourself in this moment to maybe relax, to settle, to take a deeper breath, to let go of 100% here, come down to 70%. And so you see, when we let go of planning for perfectionism, we can do it right here in this moment, as much as we can remember. Mark, did you want to say something about that? I thought I
You
saw you kind of
know,
gearing up.
I was just thinking, the way I kind of see some of what we do, it must be very confusing. It is very confusing for all of us and for patients to try and understand what's going on. I mean, it's taken us years to get to this point, even, as clinicians working in it, right, to gain a deeper understanding. But I think everything that you've said today and a lot of our webinars focus on trying to make sense of it for patients, because it's already complicated. How the nervous system changes, how our emotions get affected. So I guess what I'm saying is I hope that for our patients, that they look at what we do and that it helps them understand what's going on inside of them, because it must be, it's something that must be not only confusing but frustrating. And it's just, patients are just trying to get a handle on what's going on. They don't really understand. I mean, if I reflect back, 25 years or 20 years, even 15 years in practice and where I am now, I would give you a completely different answer, because I didn't have the knowledge then. And I hate to think what another 15 years of doing this might do. I might actually be a lot, might be better, but, whereas we can only do as well as we can right now. But I'm hoping that for patients, this kind of shines the light on the process of what's going on inside you. And maybe it helps them cope or accept and
Yeah.
move through this journey with greater ease, because it must be very difficult. It is very difficult.
So hard on ourselves to begin with. As humans, we're so hard to begin, so hard on ourselves to begin with, and then throw chronic pain in there, and sometimes we just get harder. And I'm thinking about what you said about the medical system and doctors, and I think there might be perfectionism coming in there when a doctor can't fix something. Like, because you're so used to being able to get a good outcome.
Right.
And for, a lot of GPs who don't have the information, or they feel helpless in the face of when we can't do something about it, sometimes their perfectionism comes in. Would you
I
say?
I I totally agree. I think there's a few things like, we're trained to like identify a problem and fix it. So first of all, as a doc, if you don't fully, if you haven't got what you think is a handle on the problem, it's really scary, because it's like, oh, okay, well, I don't have the answer, right? So you send people for tests, you do this, you still don't necessarily have an answer. It's an uncomfortable position to be in
Mm-hmm.
for a lot of physicians. And then, the other thing I hear from patients who've either had surgery or have seen a neurosurgeon, like, well, I've done everything I can for you. There's nothing else to do. Like, okay, well,
Mm-hmm. I hear that a lot.
yeah, I hear that a lot. And it's like, yes. And my comment is, and so what else did they suggest you might want to do? Because I'm at this point, like,
Yeah.
like, I'm not saying they have to have all the answers, but maybe just some compassion and saying, this must be very difficult. And
Mm-hmm.
I understand that, surgically, there's nothing I can do for you. But, I think what you need to look at is the other options, the non-surgical. And it's a lot of the time the way the message is delivered. And I mean, I don't always get it right. I mean, some days I might deliver that message and less than thoughtful way, because it's a difficult, tough day. I mean, you don't get it
Yeah.
right all the time, but it's just sometimes the way that message is delivered to patients, it's kind of important, because it kind of sets the tone.
Yeah, absolutely. And I think
Yeah,
just hearing
not being
you right
validated.
now, and hearing you right now being vulnerable as a physician in the healthcare, as a medical professional that people in pain kind of rely on, somewhat like, coming to the clinic. I think that's helpful to know on that side of things, that you guys and women are also vulnerable, to this. I think that's very helpful, because vulnerability does connect us here. I mean, I'm reading the chat box, and I'm just having so much compassion, and I hope everybody else is kind of feeling that maybe here your nervous system can relax here a little bit. Like I'm Gary says survival seems overrated now. I don't know if it kind of made me chuckle, but I also at the same time, I think maybe what you're saying is, like, in this day and age, it used to be number one on the list. Now we still want to survive, but we don't really have to worry about it that much.
Someone said, was Mary said, no perfectionism for you either, Mark. And I've been driven my entire life by certain survival skills, and whether it's like doing a lot of anesthesia call, being up in the middle of the night, making sure that nothing goes wrong, being really on your case. But my journey with pain, I think part of the reason I enjoy, I won't say that I get something from these webinars, is we don't have all the answers, but this is all I have to give right now, amongst the interventional stuff, because the interventions don't work for everything. I'm well aware of that. Maybe they relieve some of your pain some of the time, but that's why I believe this other side is so important.
Yeah.
Because this is what else we have to offer. It's not a complete solution. We all know that, but at least if we can impart a better understanding to patients, and a feeling that, we recognize and we see you, and we see your problem. We might not be able to fix it.
A work in progress.
A work in progress. This is all we have in the current, as far as our expertise and what there is in the world. And maybe somebody else does have a magic solution, but there's not that many of those around. There's a lot of people.
Yes. And, I think somebody in the beginning said that they feel like their perfectionism part is in one certain parts of their lives, but not all parts of their lives. And I just want to just add that, if I'm going for surgery, I don't mind if my anesthetist is a perfectionist. If I'm flying on an airplane, I would like my pilot to be a double perfectionist in those particular roles, right? So in that way, us as human beings, we have all, access to all of these things, all of these parts. And that's what I mean. Don't get rid of your perfectionist, because sometimes you might want to pull on it. But when it comes to treatment of chronic pain, this is discussion about how it might be working not in your favor, might be working against you,
Not just recognizing it, just understand what's going on. And and someone else said something about some of the physicians in the clinic. We all have different skill sets, and that's the beauty, within our group. We know each other. We have different strengths and different skill sets, and that's the nice thing about the large group too. People take on different roles. I mean, there are some people that I would trust way more than myself with certain things, and other people would maybe use me as a resource for certain other things, even with our clinic. So it's kind of interesting. So
it's kind of knowing your strengths and weaknesses, hey, and not trying to be everything to everybody.
No, because just realizing what your strengths and weaknesses are, and I think most of us in the group, in the clinic, are good at that. We don't always know,
absolutely.
Yeah.
So
Yeah.
when I say there's nothing wrong with you, I mean, with your perfectionist, if you're finding yourself, because obviously, I mean, a lot of us here are finding ourselves in those characteristics, right? This is how you learned to adapt in your world. And the perfectionist can be like a loudspeaker or a megaphone. It can get pretty loud. And so we have the option when we notice this to perhaps turn down the dial or turn down the volume of the perfectionist. Because in the end, judgment that we're all born with, and we need to judge, when to cross the street, we need to judge when to act, when not to act. But continual judgment of ourselves creates a lot of tension and comes up with, this is what the inner critic can come up with sometimes. I'm never good enough. And I was asked, well, what is enough? How do you know when enough is enough? What is enough? That is a repetitive statement from the inner critic. I hate this part of myself. Maybe it's a part that has pain. Maybe it's a part that, is not living up to your expectations. Does that create tension? Or criticizing, I'm so stupid. Why did I make that mistake? And, it's very black and white. There's no wiggle room there. It's a label and you're never a label. Like, you may behave and do something one day and do something very different the next day. You're not one particular way. I caused my pain. Sometimes we overdo things, and that's different. Like, we all overdo things. Maybe that's a perfectionist coming out. That I want to get everything done one day. And, self-forgiveness when we push into a flare-up. So when that happens, rather than going down the judgment route, coming into, yes, I did, I overdid it and I'm having a flare-up. And now I know from my, even from the pain education groups, that this is a really common thing of human beings. And so many people that join these classes also do this. You're not alone. Or, I have to get rid of this. In that statement, can you feel that tension? I have to get rid of this. I know that would be the optimum, that would be the best case scenario. And there's a better chance of, decreasing pain when we can notice statements like that that cause tension. They're all no-win situations. We can see that. It's okay if you've been trained this way, but now we can recognize them and respond differently without adding further judgment. So here's something that, I've learned in more recent years, working with the inner critic, which I've done with people for decades now. And we often focused on, changing the thoughts and more realistic thoughts and all that stuff that goes along with CBT, cognitive behavioral therapy. Try this on for size. Instead of trying to even change your thoughts, see what the inner critic is trying to do. He or she's trying to keep you safe, trying to keep you in line, trying to keep you getting approval and praise from the outside world, but to actually have compassion for that part of yourself and know that that's just what you learn to do. And you don't have to believe now what that critic is saying to you. Because once you can see the pattern, once you can see the inner critic and hear the voice, you don't have to be it. There's already some separation. And this is one of the most profound things that, I just listened to something from Eckhart Tolle again today. Like, in my mind, he never goes out of style. That when you hear that voice, once you have heard it, you are no longer it, because you're the one that's listening to it. And I think that's a human, if there was ever a goal of being human, that one might be it, to notice the voice and know that it's not you. All right. So this does not mean giving up, but all the ways that our nervous systems an S there, attempt to avoid suffering, create more suffering often. So when we're trying to whip ourselves into shape, when we're trying to like push through pain, when we're trying to, sometimes you do have to, ignore the pain or put it over here if in certain situations, but the perfectionist wants to avoid suffering altogether, and it would be lovely, but in this lifetime, it's just not possible. So it all leads to, a sensitized nervous system that feels unsafe. So now we're going to switch gears to talk about in this last few minutes, learn to bypass the shoulds and the idea that a good life is a life lived perfectly, because that's a recipe for high stress. And if you know people, or maybe you are one who really has to strive towards perfection, you're going to know that it comes along with a lot of anxiety, and as Helen says, nervous breakdown en route. Because you might feel it for a few moments and then it topples because life comes along. And the other thing is to, think about not arguing with your thoughts, because generally speaking, you won't win trying to push thoughts out of your mind. Is there anything you want to say there, Mark, at all, or should I keep going? Oh, you're on mute.
There you go. No, I think you've said it really well. I think you're much better at kind of encapsulating and presenting that than I am. So no, I agree with you.
Okay.
Mm-hmm.
I'm really, Ina is talking about the bottom up and the top down approaches. Mm-hmm. And I think that's a really, really valuable way to think about it. So a top down would be something like gratitude practices, which are lovely and beautiful to practice gratitude. But gratitude doesn't stick in a nervous system that feels generally unsafe. So you want to kind of combine both of them, which means body and mind. And that sounds like a topic for a webinar.
Mm-hmm.
Thank you.
Yeah, we touched on that. I'm going to say maybe a year and a half ago. I think there was a top-down, bottom-up approach. I remember that. And that might be an interesting topic for the fall,
Okay.
Because again, it does combine, a variety of, we've always said, there's no one solution. You have to look at the more global, the bigger picture. Because for some people, more of a top-down approach works and less bottom-up. For other people, it might be more bottom-up and less top-down. But I don't think, that, because there is no one single size that fits for everybody. Helping patients become aware of the various modalities is kind of a role here, So I think that's a great idea. Yeah, we should run with that.
Yeah, thanks. Yeah, so using mindfulness for pain is, can disrupt this pain fear cycle. And in our context for tonight is just noticing with mindfulness, always in this moment is the only time really that you can notice how perfectionism shows up for you. And this is kind of typical of what happens when we stop and start noticing our mind. Like, is this the moment that I'm in? How will I know if I'm in the moment? I'm hungry, I want chips. And that's usually the way it goes. So if you're using mindfulness and, expecting to have a blank mind and have no thoughts, that's a perfectionist meditating, because this is really what happens. Is the thoughts bounce here and there and all over the place. And that's okay. It's human. and just notice when those perfectionist thoughts start to come in. I thought that would be helpful just to, yeah. So, where in your life do you feel moments? So, if we start, this is really bottom up. Notice yourself where you can take a deeper breath. You might find time for laughter or watching a comedy where you can be in the moment. True rest. So there's a difference between distraction and true rest. And there's nothing wrong with distraction. We need it from time to time. We need, sometimes an escape where you feel that aliveness. Maybe it's walking or in nature. When I meditate, Ellen says, when I'm listening more, that's really interesting. It's awesome. Where you feel an okayness with yourself in the moment, where you're not busy criticizing yourself, or maybe even other criticizing other people can feel unsafe. It temporarily might feel safe. When you're judging and criticizing someone else, it can feel or blaming. It can feel safe in the moment, but ultimately it might not feel safe. Yeah. So the inner critic. So if let's just talk for a moment. If it will tell you that if you don't behave, achieve, try, get a certain outcome, that you will be rejected, shamed, or not approved of, or in reality kicked out of the tribe, which is not happening these days. It used to happen way back when. So as we move, this is an important piece, as we move through maybe our patterns of I guess it is perfectionism, and allowing ourselves maybe to rest, to not be as super high achieving. Be aware that your inner critic will likely get louder because he or she will probably get a little bit scared of what's happening. So your inner critic is the one that's going to shout, go for it, when you set completely unreasonable goals, right? So instead of checking in with your mind when you are moving towards something or setting a goal, you really want to check in with your body, whether it feels like this is something I should do, it feels tight and contracted, or is it an open, this is something I really want to do. I'm going to give it my best shot. That makes sense. Okay, we're almost we have been taught very much so not to listen to ourselves. So we often minimize what we're feeling, or ignore ourselves, avoid what our emotions are, and we live in a world of toxic positivity, which is not real. So there's probably days where you feel good, you feel positive, you feel totally in the moment, and there's other days where you don't, and that's okay. Of course, it's okay. It's okay to not be okay. Okay. So the antidote to perfectionism often means shifting your relationship to pain, means shifting your relationship with yourself. Safety in your nervous system and capacity has to come first. Not 100%, because if we were all 100% feeling safe, I think, we don't want to hold ourselves to that either as a perfectionist. And this is why it can be so hard to hold changes of patterns and habits when we don't feel completely safe in it. So here's something to listen to your body and what it needs. This, I want to just also qualify this, that what it needs is not always what is most comfortable. So chronic pain is, yes, it's an alarm that keeps on going off. It doesn't necessarily mean there's any damage or something harmful going on in your body. But listening to your body, yes, I have pain, and I'm going to move gently anyway. So this is where we don't push through pain, but at the same time, we don't ignore it completely and not do anything. So what if your pain was a calling just to listen, to support it, to look after it, to move through it before it gets louder and louder and louder? And a big part of this is self-compassion. So making space for everything. So all of your emotions, your anger, joy, whatever happens to be here, and allowing yourself to be. And it's not letting yourself off the hook. It's just allowing yourself to be who you are. Yeah. Try practicing, when you have tasks each day, do one task at 70%, not 100%, maybe even 50% consciously. So consciously being able to practice that and still make time for small moments of rest. So we've talked a lot about pacing, and pacing comes head to head with the perfectionist. So still moving, still moving with pain, but allowing yourself time to pace yourself to rest as well. So if you can feel that balance, it's not an all or nothing. It's letting go of procrastination and taking the one next best step. And then another one, and then another one, and then maybe resting before the next one. Also, always taking time out to relax. You don't have to get this all right all the time. Watch a funny video or other fun activity. Even in the face of pain, you still deserve, you always deserve those moments of pleasure and joy, even if they just come in moments. And that, again, can come up head to head with the perfectionist. Taking imperfect action, one step at a time, and knowing that you're not alone in this, and that you don't have to get it all right, and you don't have to say or do the exact right things, because really
there is no exact right.
it is all a practice. I'm starting to think that if we can think about life as a practice, we're far more likely to take risks and treat them like experiments. So yeah, I just want to kind of open it up there again. I can see this really resonated with a lot of people around perfectionism, around all or nothing. Yeah, perfect is a word that almost should not exist. Yeah, I try this every day. I feel it's never enough.
Or changing the definition of perfect to whatever you've done is perfect,
It's good.
Acceptable.
I would replace good enough, perfect with good enough.
Enough, yeah.
That you're all doing right now in this moment. What does it feel like to say, it's good enough? I'm doing good enough because I'm doing as good enough as I can right here. See what that feels like in your nervous system. And being able to take a deep breath and allow yourself just for a moment to be off the hook for any particular outcome.
Yeah, all you can do is do the best you can as well. And just being aware that what you're doing is helping yourself, and give yourself credit for that. And setting realistic goals, like you said, maybe one task that you can manage at a time.
Yes.
Not everything.
And I think you just said something important. I think you just said to celebrate what you have done, or to give yourself credit. Often the perfectionist will not be able to give him or herself credit and celebrate the wins that happen every single day, because you don't feel like it's good enough. In terms of nervous system soothing, celebrate every single win, everything. Yeah, when you remember. And don't wait for the big ones. Celebrate, because when you look back on your life, it's going to be the small things. It's going to be the moments of good enoughness.
Yeah, the
Yeah.
small things are big rewards. You're absolutely right, Alan. It is about setting yourself up for positive feedback and success with what can I realistically do. Celebrate what you can do, and don't focus on what you haven't done or can't do today, because tomorrow will be different. It's just it's accepting that things have changed, and really look at what are the realistic things you can do without putting yourself in a situation where you're going to pay for it, or it's going to like where you take a step backwards. I think we're so driven to say what we haven't done today, what we
Totally.
Which is a recipe for setting yourself up for just a negative feedback loop.
Yeah, exactly.
As opposed to rewarding yourself and congratulating yourself for what you have been able to do.
Yeah,
Because
I
at the end of
think
the
that's
day,
so important. Yeah.
I mean, at the end of the day, what's important, it's your relationships with people and how you've negotiated your life. The number of times you've cleaned your kitchen is going to be way less important, or rearranged your closet. I mean, I'm not saying be messy, but it's an example of
Even if you're messy, you're still worthy. But you might prefer a clean house. Yeah,
I'm just using that as an extreme
Yeah.
example, but I think just working on those relationships and the relationship with yourself.
Mhm.
How you treat yourself.
All parts of yourself. You don't have to be or be a certain way. So if you've made it this far, right for this hour, I'm going to invite you, when you come off this webinar, to please just to acknowledge yourself for reaching out, for attending, for all this participation in the chat box, for sharing, for supporting each other, even just by showing up to make this a class, because it's important, and you are important, and you matter, and how you treat yourself matters. So awesome. Well, I wish everyone a wonderful rest of your evening. Treat yourself well, not perfectly, just well, and good enough. And hope to see you back here next week for if you're interested in fibromyalgia. If you want to start doing some gentle movement and mindfulness, tomorrow Juliet's doing gentle movement, and Thursday she's doing mindfulness at 10 o'clock. And I'm hearing a lot of positive feedback about her classes. I think she's amazing. So
It's been great. Yeah.
All right. Okay. Thanks. Good night, everyone.
Good night, everybody.